My name is Vanda Chiganzo, and this video explains how online social support groups geared towards preventing and treating depression among African American women may help prevent the increase of newly diagnosed cases and treat current cases of depression among adult African American women. Health disparities and stigma that surround mental health create barriers for patients and impede treatment. Depression is not only treated at lower rates in the African American community, particularly among Black women, but of those who do receive treatment, many don't receive adequate treatment. To expand the awareness of the value of contextualized data on depressed African American women, by creating an online support group for depressed African American women that is both valid and culturally relevant, would enhance compliance with treatment protocols. For many African Americans who may want to discuss the impact of racism on their mental health and physical well-being, finding a mental health practitioner who is also culturally competent is important to their healing. There are significant inequalities in care, from misdiagnosis to overuse of medications, to misunderstanding cultural expressions of mental distress. But it isn't easy to find mental health professionals trained in anti-racist practice and other anti-oppressive strategies, especially outside of major urban areas. Research has shown lack of cultural competence in mental health care results in misdiagnosis and inadequate treatment. Depression can affect anyone, but cultural and gender differences cause African American women to experience depression differently. Attitudes and beliefs about mental illness and mental health services in the Black community tend to lean toward the idea that therapy is not a traditional coping mechanism for Blacks. Stereotypes such as the angry Black woman or the Black superwoman are based in a reality in which Black women are expected to do everything perfectly all at once. Through the idea of a strong Black woman, African American women are subject to not only historically rooted racist and sexist characterizations of Black women as a group, but also a matrix of unrealistic interracial expectations that construct Black women as unshakable, unassailable, and naturally strong. But wait, if we can figure out how effective psychotherapy and social support can be maximized by electronic support groups, it could leverage social support, positive social modeling, and dynamic content to keep users engaged and to support behavior change. Online communities have an effect on participant retention and the effectiveness of an automated lifestyle intervention, just like geographical communities. An active online community might contain user-posted stories about overcoming barriers, empathetic messages of support for those who are struggling, and celebrations of success. It is important more than ever to find a provider who demonstrates cultural competence, which describes the ability of healthcare systems to provide care to patients with diverse values, beliefs, and behaviors, and taking into account their social, cultural, and linguistic needs. An online support group for African American women who suffer from depression, designed by female African American health professionals, can help strengthen and maintain the relationship clinician and patient have, proving that community building leads to effective interventions.